Good evening, everyone, and a warm welcome to this webinar from Action Pulmonary Fibrosis and One Voice ILD on business planning and business cases for ILD services. My name is Bradley Price, and I'm the Director of Policy and Public Affairs here at APF. And before we get started, I'd like to do a little bit of housekeeping. This is a webinar, which means that cameras and microphones for everyone apart from the speakers are disabled. So please don't worry if you can't see the button or turn them on. If you do have any questions for us, there's a Q&A box at the button that you can press and type in any of your questions, and we'll do our best to answer them later in the webinar after we've presented. Before we get started, I just want to give a brief outline of what we're going to discuss tonight. So firstly, I'm going to talk about why we need to discuss this important topic, including the wider context behind the need to increase provision of ILD services, and then I'm going to pass over to Sue Thomas. Sue's an independent healthcare consultant and a nurse and commissioner by background. She has vast experience in service development and transformation across many areas, including respiratory disease and neurology. She's going to talk about the opportunity the evolving NHS landscape could present for ILD services, why we need to think about business planning, building your engagement with important people to enable business planning, and then the steps that are needed to create a business plan. So, this time last year, we started asking about what it was like to live with ILD. And what we found, thanks to everyone that took part, is that ILD services across the UK are not currently fit for purpose. And this is nothing to do with the wonderful people who are working incredibly hard across all ILD service provision in the UK, but it's down to the resources available and the way that it's organised. It's not meeting the needs of patients. And we know that demand is growing, an ageing population, incidental findings from targeted lung health checks, and widened prescribing criteria for antifibrotics have contributed to an increasing workload, and yet resource is not keeping track with the demand that's there. So last year we published I Wish It Was Cancer. As you might tell, it's a very difficult title, but this was directly sent to us by someone that was in a focus group. They said they would have had more support if it was cancer. And we want to put PF and ILD services in the same level of provision as cancer services. So this project was created following a survey of over 1,000 people affected by PF, and we had workshops and focus groups in every English region of the NHS and also in the devolved nations, as well as having a focus on some less represented groups that still have incredibly high needs but might not necessarily present within these focus groups. It really highlighted that there is a postcode lottery of care when it comes to timely access to services and care. And that's across all settings, from diagnosis all the way through specialist services into end-of-life care. And we don't think this is fair at all. The PF community, yourselves included, knew that something needed to change and that we need to do something to enable equitable access to care, no matter where you lived in the UK. So this is why One Voice ILD came about. This is our movement that brings together the whole community, from people affected by pulmonary fibrosis through healthcare professionals at all stages of the ILD journey, commissioners, those in industry. No matter who you are, if you have a real connection or an interest in interstitial lung disease services and pulmonary fibrosis, we want to stand together and call for system change. We've really focused this in recently, and we want to look at transformational system change, which means that we're trying to build a future of ILD care, which is much different from what currently exists, to meet the needs of patients and to improve provision of services. And One Voice ILD said that one of the key things that we need to do is look at a consensus care pathway. You can see it there in the bottom middle of this drawing that was done from the first meeting of One Voice ILD. And that's exactly what we've been up to for the last year. So this is an integrated care pathway for ILD services in England. We are working with the devolved nations to understand their needs and try and map something similar there too. But we wanted to set out a transformational vision of what the future of ILD services could look like in England, using some of the changes in the NHS that are happening at the moment and trying to piggyback off of that to help make it better for everyone. This was built thanks to the input of over 80 stakeholders who've been involved at different areas of the system, and it includes representatives from those currently providing ILD care and also those with lived experience. The real thing that we want to get across here, there's two areas. One is that it advocates for a regional approach to care, That means that instead of having specialist centres that kind of sit on their own, we look at the entire pathway from beginning to end and all of the shared care that goes across. And secondly, we're looking to improve joined up services at all areas of the patient journey. So no matter where you are, you get some of that shared care happening, and you can get it in a place which is suitable for you. And for most people, that's as close to home as possible. But the changes that we've outlined here will require investment in the specialist workforce within health and social care, and there'll need to be education to support community services as well. Business cases and business planning will be key to achieving this. I'm going to pass over now to Sue, and I will put a link to this report where we talk in more depth about how the future of ILD care could look in the chat for everyone to see. Thank you.
Thanks very much, Bradley. It's great to be here, and I'm looking forward to presenting this and hoping to work with many of you to complete your business plans as this evolving landscape takes place. What I want to discuss tonight is just the opportunities because of the new landscape that we've got in the NHS that are presenting for ILD services. Highlight why we need to think about business planning, look at what their commissioner's language is and how to build your engagement with clinical and non-clinical stakeholders, and the steps that are needed to create a business plan for your service. So where to start? Well, I think the first thing to do is really to identify who the stakeholders are that are relevant to your business case. Who do you need to present your plan to? Obviously, when you're doing a change in services, it's going to have implications on finance and also on the services. So you need to know who you're going to present your plan to and who will make the decisions around any changes that you want to make. In doing that, across the board, whether we're in England, Scotland, Northern Ireland or Wales, we are looking at integrated services for the future. So you need to know what your local integrated care board or health board priority areas are, and if your plan's going to meet any of those. Within that, is there already a respiratory programme board that's working at the moment, that's looking at services and looking at investment? Many of the areas in England have been looking at COPD, so respiratory is already on their agenda as a priority. And so it may be that you can piggyback onto some of the plans that are already taking place and that there are already people in post who are looking at respiratory. List the information that you're going to need to gather around ILD services because you're going to have to input that into a business plan. So that's things like prevalence and incidence of ILDs and also what your local footprint looks like. So where are your hospitals? Where are the patients? Where is the flow of patients coming to your service? Additionally, what geographical area are you likely to manage patients from? And then another key thing is about who's going to be the author of the business case. There's going to be potentially a lot of contributors in order to put this business case together. So you need to appoint one person who will have overall responsibility of the document. What you need to do is engage with the clinical lead and see who is the one that is key in your service to speak to. So the stakeholders that you'll need to get in contact with are, if you're in the hospital, is people like the clinical director, the nurse director, director of business management, manager and accountant, and the finance manager. And they're important to consult with right from the start. And they will also be helpful to you if you've got to go to an investment board or a committee to present your ideas that you've got for your service. Look at the timelines for the submission of business plans within the area that you work in, and your business manager should be aware of those. Identify how often your investment board and committee meet and when they consider business cases, and bear any timelines in mind. It's not going to be an overnight job to put a business case together, so you need to plan in advance and make sure that you can stick to those timelines. Also, identify the way that your investment board or committee want to receive presentations or business plans. Is it a written business plan? Do they want to do a Q&A session with you? Do they want you to appear in person? Finding those things out from the start will help you in terms of your business planning. Just looking at the current agenda that we've got within the NHS landscape. The transformation agenda is key at the moment across all nations. It's looking at things like health inequalities. It's looking at integrated care systems that are working at the moment. It's looking at population health management. It's looking at the increased use of digital and virtual working. It's looking at transformation of outpatients so that we're reducing outpatient attendances of patients. It's certainly looking at optimal care pathways, and it's looking at things like workforce capacity and funding. We're in dire straits at the moment in terms of workforce because of the numbers that are out there. We've got lots of people retiring, and it's really quite critical that we are aware of the workforce implications in terms of any business planning that we are doing. In terms of the respiratory agenda, the long-term plan commitments are specifically around the detection and diagnosis of respiratory problems. So that's a real plus for ILD services. And it's wanting more better management of respiratory conditions at a primary care level. But we're looking more at trying to manage patients within primary care and provide care closer to home. So any of the ideas that you've got in terms of being able to make that possible will be really useful. We've also had the GIRF report and the Core 20+5 core targets, which to date have focused on COPD. But hopefully with the transformation agenda, we'll focus on ILD services. Additionally, there is increased kind of focus on respiratory services because we've now got a national clinical director, and so hopefully respiratory transformation will be on the agenda there. Just to reinforce about integrated care, we are moving towards an integrated care system in England with the development of the 42 integrated care boards, and you can see in the bottom left-hand corner that we've got the ILD services and where they're placed, but also within the devolved nations, we've had integrated care for some time there. And so health and social care are working jointly together now across the board, across the UK per se. So I think that any of the ideas that we have in terms of business planning, we need to be thinking about involving social care as well as health care. In terms of moving on, most of the integrated care boards and health boards will have a system in place where they've got a health or care board plan. This is one for the Black Country. You'll be able to find the plans online. They're usually fairly easy to find and have a summary of what the priorities are within the individual areas. But using these will help you to frame what you're working at, and see how it fits in with the local priorities that you've got within your area. And don't forget to look at what the current structures are. So at the moment, we've got neighbourhoods, in place level integrated care partnerships and integrated care systems. And I think one of the areas that we could be focusing on particularly is looking at place, what's happening within those areas of 250,000 to 500,000 patients, looking at their integrated care plans and what their intentions are for respiratory services. So the key areas for transformation, well, there's been historically little or no system level planning for ILD services. And so I think we've got a really good opportunity with transformation to be able to start that. In the past, commissioning of services has been divided by specialised and CCG funding, and it's led to fragmented care pathways and inequitable funding allocation. So that's changing for the future as the specialist commissioning budget is delegated to integrated care services. And again, you know, in the boards within the devolved nations, that budget is already there. So we need to be looking at whole pathway care that's planned with people with ILD and coordinates and delivers services to achieve the best outcomes. That's person-centered care with a population-focused delivery. So that's not just the people that are on caseloads at the moment in terms of ILD services, but the likely patients that will be in the population that will be presenting potentially with ILD-related conditions in the future. So looking at strategic planning, not just for now, but for the next 5 years. What do we need for those services? We need to be managing the need, not just the demand. and there needs to be skill mix within the workforce. So the purpose of the business case, there's a lot of text in these following slides, but what my hope is that you can receive these slides after we've done the presentation, and they will act as an aid memoir for you to actually look at what you need to put in your business plan. But at the start, what you need to do is provide a summary statement of what the business case you are proposing wants to achieve. So that could be looking at unwarranted variation that's currently existing in ILD services, so that there is some equity of care for people with ILD, and looking at how you are going to transform services so that we can get more prescribing at a tier 2 level, as outlined in the new integrated care pathway that we've done, and the new prescribing regulations for fibrotics. So what we need to do is look at building capacity within services, and why the case for change is necessary now. So you might want a simple statement that says your case for change will increase ILD service operational capacity specific with the current provider and provide treatment closer to home. So just a simple statement there that sums up what you're wanting to achieve. You need to do your groundwork first, however. So what you need to do is check what your planning requirements are. So check your trust business planning requirements. What evidence do you have that you need to change your service? Identify who your stakeholders are, and then start to put your business case together and be clear what you want to achieve. Mariam Naqvi presented the case for change for ILD services, but there is a lot of information in that report that Mariam developed, and I think that would be really useful in terms of putting your business case together. Many of you who contributed to that business case had already collated data from your own local services about those services and how they were increasing in the number of people that they were seeing and prescribing. So being able to dig that data out and use that within your business case will be really useful. So look at your priorities. As we click through, how do they fit in with your local ICB or your health board? And remember that we've got delegated budgets in England from April for the Northwest, the Midlands, the East of England, and the remaining regions will be getting their delegated budget from April 2025. So think about that, because your ICB and your health board may well have money that is available for you to start looking at. And think about the new stakeholders that are involved in terms of delivery of services for the future, because that is health and social care. In England, we've not been used to having those stakeholders as part of our health plans, but certainly with that integrated budget, we very much want to be involving them within our plans. In terms of who needs to be involved, at a hospital level, we'll be looking at people like the divisional director, patient access performance manager, clinical director, head of finance, service manager, and then clinical staff and the wider ILD network hub. And on the right, we've got some of our patients here that come from our report that we did. I wish it was cancer, but don't forget to involve people with lived experience as well, because they can be very useful in terms of supporting your business plan. Who needs to be involved? Well, previously I said, think about your integrated care system, look at place. Going back to the West Midlands again, in the West Midlands, we've got different place areas. So we've got Dudley, Sandwell, Walsall and Wolverhampton. They might not all want to be focusing on respiratory conditions, but simply by having a look at what their plans are that they've got in place and what areas they're focusing on, you may well be able to come up with somebody that will be supportive to you in terms of making the changes that you want to make. So look at things like what program boards exist. Look at who is in post. So people like transformation managers are useful to make contacts with. Particularly look and see if there is a program of care for respiratory disease. And I guess in there you will probably find COPD somewhere. What you can try then and do is make contact with those people and see how you might be able to influence in terms of ILD services. One of the big areas that is really quite key at the moment in terms of the NHS is looking at health inequalities, and particularly inequalities in access to therapies. And of course, again, the report that we did around ILD services and the experience of people with ILD shows marked health inequalities that exist for people with ILD at the moment. So that's a really useful lever for you to use in terms of engaging with the people that matter. There are also lots of charity initiatives available in terms of services that are supporting people with ILD, like support groups. And again, some of those things might be useful to build upon. It just needs you to have a look at what's available in terms of the local strategic plans that are there and see how you can utilize it for your own services. We've got lots of stakeholders that we potentially will involve in terms of business planning and developing services. Think about those stakeholders and look at who has got the influence there, who might be the key players in the business plan that you're putting together, who are the least important, but who do need to know about any business plans that are taking place, and also show consideration for people that might be receiving those services or whose service might be impacted by the fact that you are changing the services that that are currently being delivered. But you can map out your stakeholders and utilize those, and then also look at the benefits realization that exists in terms of changing those services. So there are a lot of potential benefits in terms of changing services for patients, so that they get speedier access to services, they get access to prescribing, they get access to more services available for them. There are benefits for the trust that you work in, for example, being able to streamline services in some way or set up additional services that might attract remuneration. So have a look at the benefits that potentially will exist from you changing those services, and you can make a note of them in something like a benefits realization plan, like the one that I'm showing you now. Once you've done that, what will happen if we do nothing? Well, you need to actually spell out what's going to happen if we don't make the changes that you're wanting to make. So it might be that you're not able to administer NICE approved treatments in a timely fashion or an equitable manner, and you might be putting patients at risks of disease progression by not doing that. If there are inefficiencies in the system, then it may impact on service capacity, and it could potentially result in things like backlog and increased waiting times for patients to start new treatments. We've got some real priorities in terms of waiting list times in the NHS at the moment and getting people through the system. So again, if you're planning on making some changes that could support that, then that's a real plus for your trust and for the ICS as well, or your health board. One of the things that was highlighted in the report that we did last year was the fact that people with ILD really value specialist nurses. They're a really important resource to patients. And I guess one of the priorities that you might have within your area is the ability to increase your specialist nurse resource. Inadequate staffing numbers of nurses can result in inadequate delay and in terms of patient counselling, screening, and administration of prescribed treatments and monitoring. And I think that one of the real important issues is to look at where our specialist nurses and also our specialist pharmacists can come from. And if you're putting a bid in for more of those resources in your trust, just spelling out exactly how it can help build capacity in the system will be a real plus. We've also got issues in terms of the prescriptions of antifibrotics and that need to try and create more tier 2 sites that could support the ILD hubs, the tier 3 sites in the prescriptions and monitoring of patients that are having antifibrotics. So again, it might be that you're wanting to develop a tier 2 site, and you can spell out the benefits of that and what will happen if you don't do anything about that. The first step really in terms of business planning is really to develop something called an SBAR, a situation, background, assessment and recommendation of what the issues are. So do the groundwork first, look at your planning requirements and check what needs to go into that SBAR so that you can have a succinct summary of what you want to do, what the current situation is, what the service change you want to make is, and how you will manage to do that. It only needs to be a couple of pages long. There's an example on the left here of what an SBAR looks like. It's only short. But it's really useful to do that up front to get your thoughts clear before you actually start to complete a big business plan with lots of detailing that your trust might require. The picture on the right-hand side is a full business plan, and it's useful to check with your trust if they've got a template business plan that they want you to use, so that you can see the areas that they want covering within it and have some understanding of the information that you need to get. So what do you need to put into your business plan? Well, the objectives and intended benefits. So, what are the benefits for patients and families? What are the clinical outcomes? What are the treatment options? Things like waiting list times, how that will impact on workforce, and then benefits across the integrated care system. As I said at the outset, there's quite a lot of text on these next slides, but the whole idea is that you'll be able to look at these slides after the webinar is finished and utilize these as an aid memoir for your own business planning. The next thing is, again, looking at objectives. Is this change in the service to allow timely access to ILD advice at all sites? It might be to train advanced practitioners, including nurses and pharmacists, so that you've got increased capacity. It might be around reviewing and modernizing strategies so that you're better meeting patient need. It might be looking at clinic capacity so that you can network with the regional ILD hub, or ensuring that patients have access to specialist nurses or other members of the integrated care team. Again, objectives looking at things like the importance of early referral and how that will impact on patients, earlier diagnosis and provision of antifibrotics. Again, more than ever, it's important that you think about your local health board or ICS and identify to those service leaders how improving your ILD services through your business plan is going to help them in terms of their system priorities. Again, remember, for in England, the ICS's priorities are around looking at population health needs, planning and modelling demographic service use and workforce changes, looking at how to prioritise and plan and address need, looking at tackling health inequalities, and then ensuring the priority areas in the long-term plan are funded and providing good value and better health outcomes for patients. So those listed there are some ideas around the objectives that potentially you might want to add into your business plan. Again, looking at activity and impact, your plan needs to outline any number of changes that are going to be made in the year, like additional clinics that you want to make, changes to the number of patients per clinic. Does that proposal make efficiencies in terms of the number of clinic patients need to attend? Are you going to have a one-stop shop, for example, so that they only have to come to the hospital once? It needs to look at the anticipated patients that you are seeing at the moment, but also that potentially that you could see in the future if those changes are made. It will also need to add into it things like any administrative support that you require. But when you do that, consider the hours that are gained by the clinical teams if you do add administrative support in. It's a good idea when you start thinking about any changes that you want to make to put the totality of the service in that you have got a vision for. So don't just do it incrementally and think, well, I'll put a bid in for a service coordinator today, and then next month I'll put a bid in for a nurse. Put everything in together at once. You have more chance of getting part of the bid that you've got rather than doing something incrementally. A summary as well in terms of the impact of equality and diversity is useful in this area as well. So looking at what the variation is in care pathway delivery, looking at improving access to treatment, and looking again how increased capacity might help to service those harder to reach patients who are less likely to engage with healthcare providers. When you do your plan, you need to put in what the risks are. Often it's a good idea to put 1 or 2 ideas around how you might want the service to change for the future. But if you've only got one option around what you're wanting to do, consider the impact of doing nothing at all. So if you're not going to make those changes, will you get poorer patient outcomes? Will there be a possible increase in hospital admissions? Will you risk not complying with national guidelines and the consequences of that for patients and the trust? Are patients being denied an evidence base against national policy and national guidelines? Is there a reputational risk to the trust by you not improving the services that you've got already? Is there a risk to patients not receiving appropriate treatment? All of these things are really important to think about and add to that plan. And particularly where you're really, really busy, as everybody is at the moment, by not increasing the capacity that you've got in the system, is there a risk of staff burnout and the risk of staff leaving? Because there are real challenges at the moment in retaining and supporting staff at the moment. Mitigations, again, look at what mitigation measures you put in place in terms of the business plan to make the service more resilient, aligning capacity and allowing for future developments in treating respiratory disease in the area. And think about, if we're putting this plan in and improving the situation, you will be a centre of excellence for the trust. So it's brownie points for the trust, really, and also providing opportunities for the centre to potentially take part in things like clinical trials and further research. It's also providing a greater income stream for the trust as well. We need to put in what monitoring we're going to do in terms of monitoring that you're going to do to show that the plan, so that the change in services is working. For monitoring, look at monitoring of referrals, monitoring postcodes, aligning requirements for access and diagnosis and treatments. Look at things like monitoring if your revised services made improvements in reducing things like emergency hospital admissions or people having to attend outpatient departments. Evaluating patient and family impact of changing services is always important as well. And many people in the I wish it was cancer survey said they had a real wish to be able to have services closer to home. So again, that's one of the priorities in the long-term plan. So if you're able to monitor what patients feel about services as they change, that's really useful as well. As is undertaking clinical audits and service audits so that you can prove whether you've had cost effectiveness, reduction in waiting times and increased patient satisfaction. Just in terms of a summary, as I said, there's a lot of information in the slides, but just really some of the key components to writing a business plan is, at the start, we really need a purpose for the business case. So that's your executive summary. So a short summary of what it is you want to achieve by writing the business plan and how you will do that. You'll need to provide the background to the service that is running currently and where this current service model is not delivering the service that you want it to deliver, trying to improve it for transformation, to make it fit for the future, to take on board some of those additional patients that are now being identified as having an interstitial lung disease that may not have been around before. We've got increased prevalence. The report that was developed last year showed how an increase in the numbers of patients had materialized, how increased patients were being prescribed how increased numbers of patients were being prescribed antifibrotics. So, putting some of that detail into the plan. Looking at the national strategy and direction of travel, so that's all about transformation. It's what NHS England is wanting to achieve for our patients in England, and it's what the health boards are wanting to achieve in Scotland, Wales and Northern Ireland in terms of respiratory services. A section on case for change, what it is you want to do, what the requirements will be for that, what your objectives and intended benefits are for the system. Then looking at the activity and impact, including equality and diversity that will have, your risks and mitigations, and then finally, how you will monitor how those changes in services have taken place. So that's really a summary of the type of thing that we would want in a business plan. And as I say, you'll have the slides so that you can see a little bit more of the detail on that. And Action for Pulmonary Fibrosis is also developing a business case toolkit that you will shortly be able to have access to as you want to make your business plans a reality in your own local areas. So in terms, just to finish off, I think writing a business case can feel like a very daunting and time-consuming task. Hopefully this presentation, despite all the gremlins that have got into the system, have provided I hope it's provided a springboard for the first draft that you're going to do. So good luck and let us know how you get on. We've got quite a few areas that are currently wanting to work with us at the moment to make changes to the way that their services work. So we do hope that we'll be able to provide some support for you in that. I'll close there, and if there are any questions, then we are happy to answer them. And I do apologise for all the break in the proceedings here. I don't know what went wrong.
Thank you very much, Sue, and apologies to Rob for the technical difficulties. There's some things, always goes wrong when you don't want it to. So just a reminder that there's a Q&A box that you can open at the bottom of your screen. If you have any further questions, then please do feel free to write those in and we'll try to answer them as we can. I've got a question to start us off, Sue. So you've been on both sides of this. You've written lots of business cases that have been successful, but you've also been the person that decides and helps to get these business cases approved. What's the one thing that jumps out to you or that you try and put into your business cases, maybe right up front, that will make a commissioner sit up and listen?
I think patients have always been central to that, really. A lot of the work that I've done has involved patients centrally within the business planning process. And I think where we're able to demonstrate that patients are getting a bit of a raw deal in terms of the services that they are receiving, that's really, really helpful. We should be a patient-centered service, and there is clearly great inequity at the moment in terms of service delivery. That's not just in ILD services. I think that's across the board from the NHS. But I think that where we've been able to show data and comments from patients around the services that they've been receiving, I think that's really been very useful to have that lived experience for the commissioners and for the managers. We're not going to get we're not going to get all our business plans accepted, and there is only a finite amount of money within the NHS at the moment. But some people are getting a pretty raw deal, and I think that I wish it was Cancer Report. I think it's one of the most emotive reports that I've ever been involved in developing. Just to see how poor services, and that's not being critical of any of the services that there are at the moment, but it's just the availability of services, really, because there is such a postcode lottery, as you said at the start, Bradley, around the way patients are receiving services. So if we can use that patient information in there, how patients are using the services, some nice quotes around that, and how services could be improved, I think that's always very, very useful. It certainly resonated with me as a commissioner and a manager when I've been reading through business plans and going through presentations, those that have really involved patients in that process and demonstrated just how those services need to improve. It's always resonated.
Thank you. And just a reminder that Action Pulmonary Fibrosis can be your broker in that situation as well. We can help with both the data in terms of the I wish it was cancer report. We can break it down by area as well as the data that we collected from the focus groups. But equally, we can put you in touch with your local support group, and you can go and, you know, ask them directly, what would you like to see changed? You know, what difference would it make to you if this service improved, and really collect that data firsthand.
I think one of the things that I like as well about board meetings these days, most of the board meetings that I attend, they always have a patient representative at the start of the board meeting to tell their story about what it's like to live with a particular disease. And I think that if you've got access to patients who could go along and get your board when they're meeting to invite a patient along to talk about their experiences of living with an ILD, it would be very, very useful. They certainly, you know, do make a welcome addition to the board meeting, so that the board members can understand, you know, exactly what it's like for those patients. So, you know, do try that, and I'm sure the charity will be able to highlight patients that would be willing to take part in things like that.
Absolutely. And that leads nicely on to the next question. I went to an event last year, and there was a session similar to this, and some people said, well, no, not a single person in the room said they had a contact within their ICB, and many of them didn't know their service managers and the right people to go to for these kind of business cases. Do you have any tips for how to find out who that is and how to get on their good side?
I think I think when you're kind of looking at the area that you're working in, you need to find out exactly who is involved in terms of the programs of care that are around. So I generally, if I'm going cold into an area, I generally look through backboard papers and see what the priorities are, and see who's aligned to those. And then I look at, you know, kind of different levers. So it may be that there isn't a respiratory program board, but there may be one for frailty, or there may be one for palliative care. So it's just really trying to, you know, kind of look at what's happening within that local area. So you need some local knowledge around what's happening, and you can probably get that through board papers. It may be that, you know, you check who are the non-execs on the trust board. You know, is there anybody that's friendly towards respiratory services? Anybody, you know, got family members that have had an ILD? Utilize anybody you can. It's just a matter of kind of tracking down that information, I suppose.
Thank you. And we do have a list at APF of some regional respiratory people within the NHS that work on the policy and commissioning side, and a couple of contacts within ICBs as well, and we'll continue to grow those. So if you do have any questions, please do come to us with those as well. We've had a question. I'm going to click answer live and see how this happens, but they've said, as a local hospital, we work at a 1B level. So for those that haven't read the report, that means a local hospital performing respiratory services. They may have an ICB lead and an MDT in the current situation. It says, what benefits would the trust get by going to level 2, and how can you advocate for those? And then the second question, which I'll answer first if that's okay, is how many level 2 centres do you recommend per ICB/county level footprint? So again, tier 2 in this situation means we're looking to create a new system where we have new specialist prescribing centres within each region, further to the existing specialist centres, and they will be able to prescribe antifibrotics and give care, treatment, monitoring, follow-up closer to home for the patient. Because they don't currently exist, we will need to understand, you know, how many we need and where they should be. So I will say that I'm working with a couple of areas on this at the moment, and it seems the way that this is being developed is largely around population need. If you only have one specialist centre in your area, then patients are having to travel an enormous distance to go and have several parts of their care that could easily be performed closer to home, to take that burden off them both physically and financially. So the way that they're looking at it is, where can we put the centres where we have existing resource and knowledge and expertise, so that we can serve the most people and have fewest people have to travel a very long distance. And that's probably best discussed at a regional or local level to map that out. And again, that's an NHS priority, having that care closer to home. So you can use that within your case to to try and put that forward. So the question to you, Sue, was what benefits would the trust get by going to level 2 or tier 2?
Well, I guess from a trust perspective, it's increasing the expertise that you've got at that level in terms of managing patients. So a professional development, improvement for the trust and the staff that work there. It's also potentially bringing revenue into the trust by seeing additional patients. So there is that, but it's the credibility, I guess, as well, of moving to a level 2 service that the hospital would get in terms of the services. So, I think there's, in terms of the benefits realization, there are benefits all round, really. And what we're hoping is that we're going to raise awareness a lot more of ILD at a primary care level, and that we're going to upskill many more people really in terms of managing patients. At the moment, as you said, Bradley, it's difficult for a lot of patients to be able to travel to a central hub that might be miles away. So, by having local services, it benefits everybody. But I think, from a professional development point of view and from a financial point of view, it should be something that the trust would welcome.
Thank you. And that brings me nicely on to my final question, which is around how can those that have seen success and that are doing well help those and provide examples for services that might want to imitate what's already gone before, potentially in some of the more innovative areas, should we say? Well,
I think that more webinars like this, where people are actually sharing information about what they're doing, would be really useful. Peer review articles are really good. Networking with your colleagues through the One Voice ILD network would be really useful. We've got the Futures NHS Futures collaboration platform, so writing short case histories up about how you're delivering services and publishing them on areas like that. There are respiratory networks on the NHSE website where they are taking case histories, so I think it's really useful to try and kind of explore different ways of working. At the moment, one of the members of the stakeholder group is looking at working directly with a community diagnostic centre to screen patients within that community diagnostic centre. So that's a different way of working. We've had contact from a few pharmacists who are wanting to set up community pharmacy programs similar to ones that have run for COPD. So, there's lots of ideas out there, which potentially, I suppose, are not shared at the moment. They're kind of, you don't necessarily think you're doing anything innovative in your own local area, do you? And you don't want to talk about what you're doing because you think it sounds as though you're bragging, I suppose. But I think if more people could, highlight what they're doing, perhaps, we could develop a template to just detail some information about how services are running in particular areas, and what's innovative about the work that they're doing, and we could share that would be really useful. But I think one of our ideas with the business planning toolkit is to put some examples of how different services are running in different areas, so that others can see exactly what's happening, because all of the health boards and integrated care systems are all different, so there isn't going to be one model that fits all. There's going to be a need for different variations of the service delivery, so the more we can share, the better.
Thank you very much. So with that, I think we're going to draw it to a close. So huge thank you, Sue, for sharing your wisdom with us all, and thank you to everyone who's joined us tonight. This session was recorded, and we will make it available at some point soon on either the Action Pulmonary Fibrosis website and or YouTube, and share that with everyone, along with a copy of the slides. And as Sue said, she's also working on a toolkit that will assist with writing business cases, and will make this widely available. If you do want any more information on anything you've heard tonight, or you want to keep in touch with what's going on with One Voice ILD, please do get in touch with us. The email is on your screen, OVILD, One Voice ILD, at actionpf.org. With that, thank you very much and have a good evening.
Thank you.